something about, okay, I would like to share something about the clinical application of scalp acupuncture. So today I would like to.
Professor Du, can you share your screen?
Yes, I can. So I'm sharing. You notice it?
No.
Sorry, just a moment. Is it okay?
I still can't see it. Still can't see the.
You can't see it?
No.
So
Not sharing.
So, and when you come to the Zoom in the middle, there is a green and with the arrow screen sharing. So you
Okay,
click.
I see the. I clicked it already, and
then you will see your file on your computer. You double click on your computer on the file.
it comes now.
No.
Not yet.
No.
There are many screens. You just click one of them to share. Share.
Yeah. So you first open your PPT file on your computer, then
Yes.
and then you come back to the Zoom, and the meeting in the middle, there is a green arrow, and towards the top, you click a share screen there, and then you see many files. Yeah.
Yeah, you're screening now. You're sharing now.
Yeah.
It's
Okay.
coming.
Great. Great.
Okay. Thank you.
Thank
So
you.
today, thank you. Again, I would like to share something about the scalp acupuncture clinical application. And I would like to share 3 to 5 contents if time permitted. So the first part, I would like to share something about the definition and mechanism. So we all know that it's a kind of method by treating diseases on the specific area of the scalp. So it's based on both traditional Chinese medicine and Western medicine. So from the traditional medicine, we can see different kinds of books have noted about the scalp area. It's a place that all young meridians confluence. And in meridians, in fact, connect head directly or indirectly by young meridians. So in this way, we can understand that the head is a center of the whole body energy. So in this way, we can understand that just to stimulate the area of the scalp, we can get the result of regulating the function of organs. So according to the theory of Western medicine, we can combine that the theory of protected area of functional location of cerebral cortex on the scalp. So talking about the scalp acupuncture, we see that it has been used in 2000 years ago, but at that moment, we didn't have a very complete system, especially on the theory. But it is greatly developed after the foundation of New China, especially around the 1950s. But it is greatly improved around 1980s. The representative figures of this field, so we can see that Professor Jiao Shunfa, so I will say that he is a very famous doctor who invented very famous scalp acupuncture theory as the first one. And he formed a very complete theory of scalp acupuncture location, indication, and manipulation and precautions. So as time passed by, there are different kinds of doctors after their years experience. They just wrote articles and they made research works and they just set up different kinds of doctrines. For example, Professor Sun Shentian, who worked in my university, he is now a leading figure in the scalp acupuncture field in China. Now, he's over 80 years old, but he still works in clinic for patients with scalp acupuncture and treats more than 100 patients per day. So all the students who would like to contribute a lot on scalp would follow him and learn something about the research and clinical skills. Another representative figure is Professor Yu Zhisun. He also works in my university, and he made a lot new ideas. And these new ideas were written in textbooks, especially the famous one, cluster needling and long retaining of scalp acupuncture theory. Because in my province, it's a cold place. We have lots of patients suffered from hemiplegia, and these professors concentrate a lot of their energies to do research work. And after more than 40 years experience, they just set up different kinds of principles for the treating of this kind of problem. So until now, we still follow the guideline, the principle of Professor Yu's idea in the world for the patient. So the next part, I would share something about the location and the indications of the scalp acupuncture according to the international standard lines. So we all know that this scalp acupuncture just formed within this 40 to 50 years. So I will say it's a new skill, it's a new method. So different kinds of doctors from different places, they would like to do research work on different kinds of problems. For example, digestive or urological problems. So we would like to say that in order to spread it widely and to let most of doctors grasp this kind of skills. So we are now following this standard location and indication in this way. So the first line, I would like to introduce the MS1. So MS1 is frontal midline. So from the picture, we can see it's on the forehead, 1 cun in length. So we just stimulate from Shen Ting straight down along the meridian in 1 cun. So this area is used for treating the problem of epilepsy, mental disorders, and retinopathy. And the line 2 is MS2. It's also on the forehead. It's from Meichun and 1 cun in length along the meridian. So it is used for treating the problem of coronary heart diseases and bronchial asthma, insomnia, bronchitis, nasal disorders. And the third one is MS3. It's also on the front area. On forehead, it's from Toulin Qi. It's also 1 cun in length, and from Toulin Qi down along the meridian. It's used for treating the problem of acute and chronic gastritis and digestive ulcer, liver and gallbladder disease. And the fourth line is MS4. It locates on forehead and 1 cun in length from the point Towei 0.75 cun medial and straight down the meridian. So this line is used for treating the problem of dysfunctional uterine bleeding, impotence, and seminal emission, and uterine prolapse, and urinary frequency and urgency. And the fifth one is vertex midline. It's on the vertex area. And from the point Bai Hui to point Qianding on the midline. So it's used for treating the problem of lower back, legs, and feet disorders, such as paralysis, pain, and paresthesia. Also used for cortical.
最好呗。
对，你看这不
Okay. And the sixth one is anterior and vertex temporal oblique line. It's on the vertex and cephalic area. It's 1 cun anterior to Bai Hui and obliquely to Xuan Li. So this line is from the idea of Dr. Jiao Shunfa. He named it motor zone or motor area. So in this way, we can understand that it's used for the motor problems. And this line is divided into 5 equal parts. And the upper 1/5 is used for treating the paralysis on the contralateral side of the lower limb and trunk. And the middle 2/5 is used for treating the problem of paralysis on the contralateral side of the upper limb. And the lower 2/5 is used for central facial palsy, ataxia, aphasia, salivation, and dysphonia. So this is the line 4, line 6. And next one is line 7. This MS7 is named posterior vertex temporal oblique line. So it locates 1 cun posterior and parallel to anterior vertex temporal oblique line from Bai Hui to Qubin. So this is posterior vertex temporal oblique line, MS7. So it's also divided into 5 equal parts. And the upper 5th one is used for the paresthesia on the contralateral side, lower limb and trunk. And the middle 2/5 is used for treating the paranesthesia of upper limb on the contralateral side. And the lower 2/5 is used for treating the paraesthesia of the head and face. So this is MS7. The next one is MS8. So the name is lateral vertex line 1. And this line locates on vertex area. It's 1.5 cun lateral to GV and 1.5 cun in length posterior from Tongtian here. So this line is used for treating the problem of migraines, ataxic aphasia, peripheral facial paralysis, and oral disorders. And the 11th one is MS11. It's posterior temporal line. It's located on the temporal area from Shuaigu GB8 to Qubin GB7. So it's used for treating the problem of migraines, tinnitus, deafness, and vertigo. The 12th one is MS12. It's upper occipital midline. It locates at occipital area, 1.5 cun in length, from 墙间 GV18 to 脑会 GV15. So this line is used for treating eye problems. So now it's popular in China for treating the problem of myopia and eye disorders. And inside my hospital, there are many doctors in this field. They are applying for different kinds of funds from the state government to do research work in this area about the scalp. And it's also used for root ringworm. And the third one is MS. Third is upper occipital lateral one. So this one locates on occipital area, 0.5 cun lateral and parallel to upper occipital midline. This line is used for treating the problem of cortical visual disorders, myopia, and cataracts. And the last one is lower occipital lateral line. It locates also at occipital area. It's 2 cun in length. And from 玉枕 to 2 cun straight down the meridian. It locates also at occipital area. It's used for treating the problem of imbalance resulting from cerebral disease, occipital pain. So this is the location and indication. There are totally together 15 lines for scalp acupuncture of the international standard lines. And next, I would like to share something about the manipulation. So
我有参加国际会议了，娘子，我多厉害！
So concerning the manipulation methods, first I would like to share the posture and for the patient. Normally we should choose the comfortable posture for the patients and convenient posture for the
不行，
practitioner.
咱连主治都没有，咱差远了。
So
Can I ask that everybody mutes who's not speaking? There's one. Yeah, thank you very much. Thanks. Sorry, Professor Liu. Thank you.
okay, thank you. Now it's okay. So talking about the posture, it depends on the problem the patient suffered from. For example, the paralysis of the lower limb. So I prefer let the patient lying on the bed. And so in this way, we can stimulate the scalp. At the same time, ask the patient move the extremities. We give the active or positive extremities just to enhance the treating result of the scalp acupuncture. So the posture depends on the problem the patient suffered from. So normally the seated or lying position is recommended. And the selection of needle. Normally we use the number 20. Normally we before we use the number 28 to 30 and 1 to 1.2 filiform needle. Nowadays, some patients it depends on the problem as well. We still use the number 20. And the sterilization, we can use the 55 alcohol cotton ball to sterilize the area of the scalp we want to puncture, or we can use the iodine. It depends on your habit. And the insertion is the key point of the scalp treatment. So it requires the practice. So normally we just take the needle with the thumb and then the index finger. If you don't have enough practice, you cannot insert the needle. So we should insert quickly and twist quickly. And so in this way, the students inside the hospital, inside the university, who wants to study scalp acupuncture, the practical insertion is the first step they should take. So normally we just insert the needle obliquely to form an angle of about 50 angle between the needle and the skin. So if you feel it's difficult to twist the needle, it means that you didn't insert the needle into a exact area or exact depth. So if you feel it's easy to twist the needle, it means you reached the needle at the area of the subgillar region. So this is the key point we would like to recommend for the insertion. And for the twist, normally it requires 200 times per minute. And this twisting should be continuously for 2 to 3 minutes. And then we leave the needle on the scalp for 20 to 30 minutes. And then we repeat twisting the needle 2 to 3 minutes to get a very good result. So the retention depends on the pathological condition. As I talked before, and Professor Yu is recommending our doctors to leave a long retention for the patient who suffered from the semi-pleasure. And nowadays, we are using this way for more than 30 years. So normally we just insert the needle and we twist the needle for 2 to 3 times within 20 minutes to 30 minutes. We leave the needles on the scalp of the patient for at least 4 to 6 hours. And then after a while, we still go to stimulate the needle. We still use the same twisting speed just for enhancing the treating result. So here you can see that I just gave you a picture of electrotherapy appliers. For the young doctors or for the newcomers, if you don't have enough practice and you cannot get the speed of 200 times per minute, so in order to get the treating result, you can use this electrotherapy. It has a very stable frequency. And if sometimes inside the hospital, if we have 2 patients today, it's difficult for me to twist the needle for more than 50, 60 patients a day. I prefer use this one instead of twisting the needle by myself. So this is my experience I would like to share with you. And the next step is needle withdrawal. So here we should pay attention with the pricing of the scalp around the scalp or around the lines we stimulate, because there are too much blood vessels, especially small blood vessels on the area of scalp. So in order to prevent bleeding, we just palpating we just use the palpating hand, and just when we take out the needle, we rotate it, and we just press the needle hole with the sterilized cotton ball. So in this way, just to prevent the blood bleeding. So this is the needle withdrawal. So here you can see, I just gave you a video to see the manipulation of the scalp. Here we introduced the needle selection for sterilization. And you see the insertion. So we take the needle with thumb and finger. So 2 centimeters of the needle tip. After the sterilization, so 5 to 10 centimeters with the scalp, and then insert the needle. So the certain depth is very important to manipulate. Here we can see the twisting speed. So when you twist the needle, you must fix the shoulder, the elbow, and the wrist. So we used the thumb pad and the finger medial side to twist the needle. So every minute we just twist the needle at 200 times per day. Normally within 5 to 10 minutes, the patient can get a very good result. So this is the manipulation video. I'm not sure whether you can hear what I said just now. Hello? Hello,
Hello?
you can hear. So you can hear my explanation of the video?
Yeah, the video
Yes.
worked very well, yes. And we have a slide on precautions now on your screen.
Okay, thank you. Now the next step is also the last step that I would like to share is precautions of the scalp acupuncture. So talking about the precaution, first we should pay attention with the very strict aspect technique due to the pressure of the hair. So normally we should sterilize the area of the stimulating at least 2 to 3 times with 75% alcohol. And the next step we should pay attention is that when we manipulate, when we use the very first manipulation, we should pay attention with the patient's expressions. Because this fast twisting sometimes results in the fainting of the needle. So, and sometimes comes out the needle stuck, needle bent, and needle broken. So if the patient don't feel well, it's better twisting the needle should use the lying position. It depends on the patient's condition. So the next one should be pay attention for the expressions of the patient, complexion of the patient. And the third step, we should pay attention that the scalp acupuncture is not advisable for the infants because their cranial sutures have not been ossified. So it's dangerous. And then the last step we should pay attention is that great care should be paid for the patient who have a very severe inflammations or very high fever or heart failure, especially for the patient after stroke. In the acute period, we should pay attention with this kind of condition. So this is the last precaution I would like to share. And at last, I would like to introduce our group. So this is Professor Sun, who is treating the patient with peripheral facial paralysis. So you can see he's choosing the scalp acupuncture with very fast insertion and fast twist. While he's twisting the needle, he asks the patient's sensation. So here I would like to say that Professor Sun Shentian is a very famous acupuncture doctor in China, especially in the field of scalp acupuncture. And he set up the first acupuncture and neurological department in the hospital of our university. And he is the first one who introduced acupuncture skills in neurological field. And he is now over 80 years old, and he has been working in this field more than 50 years. And among his 50 years experience of clinical and research work, he had did a lot on the scalp acupuncture. And he, the famous one, he made a very outstanding idea is that the acupuncture, scalp acupuncture field. And he set up this idea, and he has been a leading figure in scalp acupuncture research, especially his research, the trans-scalp acupuncture, repeated needling on the scalp, has explored the peculiarity of points, especially for the problem of nerve injury and spinal cord injury and series of brain injury. And nowadays, he's leading a very big group. And this group contains 200 doctors who would like to contribute to the scalp acupuncture, especially for the problem of facial paralysis and semiplegia, hemorrhage, and the problems of the nerve system problems. Because in Heilongjiang province, we have the habit of eating too much salt and drinking too much alcohol, and together with the cold weather here. So we have many patients suffered from stroke. So in this way, the state government gave us a very big fund for doing this kind of research work. So around this call, we did a lot, and Professor Sun Shentian has fostered more than 100 doctoral students and 200 master students who would like to contribute on this field. So this is something I would like to share with you today. So if time permitted, you can come to my hospital, to our university to see how scalp acupuncture works in Heilongjiang province. So you are welcome anytime. Okay, thank you very much. And thank you very much for your attention.
Thank you very much, Professor Liu. That was really interesting and informative presentation. Are there any questions? I might just ask one while others are thinking. So in stroke, it seems like it's used in stroke. Are there, you know, when you look at Western hospitals which have stroke units in them, patients who've had strokes and they have a hemiplegia, are there opportunities to bring this into, you know, you have a Confucius Institute in London, are there opportunities to bring this into stroke units in the NHS, for instance, in the UK?
Yeah, I would like to say that nowadays we are widely used, the scalp acupuncture is widely used in the department of gynecological and the dermatological, and also the digestive department. And for example, the problem of myopia and the problem of the dysmenorrhea and also the problem of menopause are also widely used in the scalp in our group. So we emphasize on stroke, but we are now enlarge our treating scope of the scalp in different departments.
And do you practice it in London?
Okay, can I explain a little bit more?
Yeah.
Because Professor worked in our university back in China. And in the UK, if the patients suffered from stroke, they are hospitalized, and if the doctors are admitted and the family members will invite the acupuncturist to the hospital to treat the patient. That is allowed in the UK. But in our Confucius Institute, the patients are mostly they are dropping by. We do not accept, some patients suffer from stroke. Maybe they cannot, visit the clinic. But the acupuncturists in our Confucius Institute can be invited to the hospital to treat the patient. Okay, that's my explanation.
Okay, thank you, Dr. Sheng.
Thank you. Any other questions?
And I commented, Tim, I think this is a very impressive lecture, and make a layman like me and able to understand, and excellent lecture. Thank you very much. And second, I would like to say, and this has blown my mind, and in the past, acupuncture and the meridian points and acupuncture points are in the peripheral tissues mainly, and this is slightly different, and it's direct stimulation of the central nervous system. And I also noticed like you treat and the epilepsy and the I guess, and for different disease, and they were other acupuncture points in the periphery tissues, other places, and you can combine maybe together with the acupuncture points in the head for the treatment, for example, epilepsy and this kind of treatment, or how effective, or how many treatments and needs to be done?
So it depends on the patient's condition. So normally we use the main area of the scalp, and after the stimulation, we just let the patient lie down, and we will do very complete differentiation of the patient whole condition, and we just use the body points to compare the scalp acupuncture with the body acupuncture. And for the epilepsy, after the diagnosis of differentiation, we will give different kinds of treatment, sometimes together with Chinese herbs, with decoctions. Normally, 2 to 5 times, you can feel some changement comes out.
Okay. How easy to get it done, and for the kids, for children?
Yeah, yeah. Especially nowadays, the patient of the problem of epilepsy often comes down to to children because their brain system is not mature. So sometimes after the differentiation, we will give enough stimulation of the body points to stimulate and to just improve the grown up of the nerve system, of the brain system. Yeah.
Okay, I think we
Thank you.
should, in the interest of time,
Thank you.
move on to our second presentation. But thank you very much, Professor Liu. That was really interesting. So our second speaker is, and maybe you could unshare, please, Professor Liu.
Okay, thank you.
Yeah, thank you. Our second speaker is Professor Xiao on behalf of the Confucius Institute at the University of Coimbra in Portugal. Professor Xiao is an associate professor at the School of Humanities and Management in Zhejiang Chinese Medical University and a lecturer in the Confucius Institute at the University of Coimbra in Portugal. His research interests are international transmission of Chinese medicine and the culture of Chinese medicine. He's the author of 6 papers in SCI index journals and the chief editor or translator of 12 books on the field of Chinese medicine. And he's going to present today, as the opening slide suggests, a 4D systemic view on the Meridian essence, substantial, functional, chronological, and cultural attributes. So thank you very much, Professor Xiao.
Thank you. Thank you for your introduction. And so, my distinguished professors, ladies and gentlemen, it's my great honor to be here and to share my topic about a 4D view on Meridian essence, substantial, functional, chronological, and cultural attributes. Okay, so shall I begin, right? Okay, thank you. Okay, Meridian system. Okay, so as we all know, is the basis of traditional Chinese acupuncture, and the essence of meridians has always been a disputed subject among researchers, and much time, financial, and scientific energy has gone into investigating the essence of meridians, and this is especially done in China. Okay, in China, we have conducted lots of very vast projects on explaining what is the meridian essence, and various studies through several decades have gathered mounting experimental and clinical trial evidence and hypotheses to decipher the essence of meridians. Most studies have focused on revealing the physical structure, and each hypothesis presents its rationality and partially explains the meridian essence. However, due to the complexity and the sophistication of meridian theory, the variety of hypotheses formulated still don't form a comprehensive interpretation of the meridian essence. So based on a comprehensive and systemic analysis of the ancient medical classics in China and recent research developments and clinical experience, I would like to propose a 4D systemic view of the meridian system. And this includes the substantial, functional, chronological, and cultural dimensions. Okay, so now let's talk something about the substantial dimension of the meridian system. In the ancient classic Ling Shu, in a chapter entitled Mai Du, it reads 6 young meridians run from the head to head. Each of them measures 5 qi, and 5 qi times 6 is equal to 3 zang. The length of all meridians measures 16 zang and 2 qi. So this statement describes the length of different meridians and indicates that the meridians are substantive and measurable. And in recent years, anatomic study has been a significant component in the research of meridians, and considerable experiments have been performed to identify the substantial structures of meridians. Various studies suggest that multiple systems, such as the nervous system, circulatory system, connective system, immune system, and the cellular biological processes are involved in the physical structures of the meridians. And so as for the nervous system, this is a very frequently researched field for the meridian essence. And numerous researchers have emphasized the nervous system's relationship with the meridian system. The sensation of the qi transmission along meridian lines has been regarded as window into the possible meridian paths. And this kind of sensation is a subjective feeling that may be attributed to the central nervous system, particularly the sensory cortex and the axon reflex of the peripheral nerves. The characteristic order of sensation propagation might happen between motor neurons, and the clinical influence of needling acupoints is transmitted primarily via activating the sensory nerves. And in addition, from a gross anatomy perspective, the meridians and peripheral nerve system are roughly similar in their distribution in the body. The neural hypothesis involving the central nerve system, peripheral nerves, nerve segments, and neurotransmitters has been considered a logical basis for defining meridians. And the second system mostly discussed about is the circulatory system. Okay, in the original meaning of Chinese character of the meridian, mai is actually blood vessels. Okay, so which means ancient medical classics considered the meridians and the blood vessels to be closely related. Some investigators have proposed that meridians are artery vessels, as the blood vessel system has multiple characteristics consistent with the meridian system. For example, because the blood vessels can move the blood and can connect organs with the limbs and the joints. Moreover, the microcirculatory system distributed over the entire body by its lumen structure is closely correlated to distribution of the meridian system. In addition, the anatomy and the circulation pattern of the lymphatic system also indicate its potentially important role in deciphering the essence of the meridian system. Okay, so all these correlating systems give validity to further investigation into the meridians as a circulatory system. And the next system involved is the immune system. Some researchers show that the gathering tendons of multiple immunocompetent cells as T cells, lymphatic cells, neutrophils, and mononuclear cell nuclear phagocytes at sites of injury presents some similarity to the learning course of the propagation sensation along meridians. And the researchers have found that mast cells participate in the propagation sensation along a meridian. The distribution trend of the mast cells follow the line of meridians, and the number of mast cells along the acupoints is significantly higher than that of non-acupoint locations. And needling acupoints can also stimulate the degranulation of mast cells and produce chemokines to activate the immune responses. And the fourth system related is the connective tissue. Subcutaneous connective tissue forms a continuous tissue plan throughout the body. And a series of studies have noted that the meridians resemble connective tissue in salient ways. Some cord-like connective tissues present similar distributions to the meridian system. Anatomical studies have revealed that the 14 meridian lines are located in the connective tissue among the interspaces of muscles. Okay, so you can see the facial or the connective tissue are all over the body. They are along the muscle fibers and all tissues. So this is also very important part for the meridian essence. And convergent lines of physiological, histological, and clinical evidence have revealed that fascia superficialis corporis is an essential part of the anatomical substrate of meridians. And also other studies showed the resemblance between the meridian longitudinal position and the connective tissue fascia. And recently, researchers proposed that clinical efficacy of acupuncture may be attributed to the mechanical signaling through the connective tissue and its matrix deformation transmitting along the facial net system network. In addition, fascia is one of the tissues manipulated in acupuncture needling, and changes in the connective tissue in response to external stimuli may be long-lasting, which may explain the long-term effects of acupuncture treatment. And the last aspect I would like to mention is the cellular biological effect. Studies show that the conduction of velocity of small molecules and the low electric resistance in the cell gap junctions are compatible with the propagation sensation along the meridian. Studies have demonstrated that the content of nitric oxide correlated with low electrical resistance, consistently higher in the meridians. And furthermore, a recent liquid chromatograph mass spectrum-based proteomic study has shown that calcium iron 2+ is an important substance for the propagated sensation along meridians. In addition, the latest studies using ultramicroelectronic microscopy and immunofluorescence assay have validated morphological associations of the telecites with meridians at the tissue and the cellular level. Okay, so this is the first dimension I would like to talk about, the substantial dimension. And this part is the mostly researched part. And the next part, dimension I would like to talk is the functional dimension of the meridian system. And in spiritual pivot, fundamental visceral states, the meridians are the pathways through which the qi and the blood flow to nourish yin and yang, lubricate the tendons and the bones, and smooth the joints. Okay, and this saying implies that the meridians transport the qi and blood, balance yin and yang, nourish tissues, support joints, and connect organs, limbs, and the whole body. And here it mentioned the invisible and ubiquitous qi, which fills and diffuses throughout the body and constitutes a critical component to the functional dimension of the meridian system. Given that meridian theory is the foundation for applying acupuncture effectively, the meridian system has also been conceived as a complex functional concept that contains a summation between multiple physiological functions. For example, recent studies have revealed that meridians can activate the neuron endocrine immune network to exert therapeutic effects on target organs through regulating multi-layers and multi-systems of the body. And also studies based on ideas of physic qi spirit triad outlook of life in TCM and experiences of inward visions by qigong practitioners proposed the facial space qi hypothesis to decipher the functional attributes of the meridian. Other studies have suggested that meridians and viscera are closely correlated since the meridians are distributed throughout the body and interconnected longitudinally and laterally to nourish the tissues and organs. So the theoretical framework of the meridian system contains a subsystem of internal organs in which the name of the organ represents visceral system with particular functionalities instead of merely the actual anatomical entities. And in addition, there are also lots of studies about the field theories to relate the meridian system. For example, the electromagnetic field, the biological field, T field, they have also been proposed for the transmission line of meridians, reflecting the functional attributes of the meridian system. Okay, so this is the second dimension I would like to mention, the functional dimension. The third dimension I would like to mention is the chronological dimension of the meridian system. An increasing number of studies have indicated that time-oriented therapy has long been evident in meridian system and acupuncture treatment since ancient times. For example, the 子午流注, it is translated like midnight noon ebb flow needling. This theory is from 黄帝内经, the Yellow Emperor's Inner Classic, and also Nanjing Classic of Difficult Issues, and further developed in the Jin and the Yang dynasties. It has been generally considered as a typical representation of clonal acupuncture. 黄帝内经 describes the unity between heaven and mankind. A sequence of qi blood flow in the meridians and the needling manipulation of qi flow, laying the foundation, laying a theoretical foundation for the opening of time-based acupoints corresponding to specific time periods. A growing number of experiments have validated the time-related characteristics of meridian flow, such as the propagation sensation along the kidney and the stomach meridians presents an increased velocity in the Yu and Chen hours. And the studies have also demonstrated that this time correlation of the temperature fields of acupoints in different meridians and qi and blood meridians have shown to change in response to the changing seasons. Moreover, multiple lines of clinical evidence have demonstrated that acupuncture therapies based on midnight noon ebb flow framework have better therapeutic effects than regular acupuncture in treating diseases. Okay, so there are many diseases. This is from some published papers. And the last dimension I would like to discuss is the cultural dimension of the meridian system. The meridian system, deeply rooted in ancient Chinese culture, is tainted with thousands of years of accumulated philosophy, ideology, and the beliefs of Chinese people. So for example, the series of heaven 6 and earth 5, greatest heaven number 12, and official ranks, and the number of 3 times 9 are typical examples that reflect the influence of Chinese culture on the meridian system. 足臂11脉究经 foot and hand 11 channels of moxibustion classic, and 阴阳11脉究经阴阳 11 channels of moxibustion classics. These are the earliest extant records of meridians of this kind. Both of these 2 books list only 11 meridians without reference to pericardium meridian of the hand 厥阴, and the 灵枢本枢 spiritual pivot, fundamental transportation, and the 灵枢阴阳系日月 spiritual pivot, yin and yang with the sun and the moon, also illustrate that all the 11 meridians, but without the mention of pericardium meridian of hand 厥阴. So this phenomenon may reflect the ancient Chinese philosophy of correspondence between humans and universe. Special meanings were endowed to different numbers. For instance, in the spring and autumn periods, the Chinese worshipped heaven 6 and earth 5, which are the constant numbers. Heaven pertains to yang and earth pertains to yin. Therefore, 6 yang meridians and 5 yin meridians without hand 厥阴 meridian correspond to the heaven and earth respectively. Later in the Qing and Han dynasties, the number 12 was regarded as the greatest number of the heaven and became widespread. Moreover, with the influence of ancient pulse diagnosis and anatomy and the concept of qi, blood, yin, and wei circulation, the 11 meridians gradually developed into 12 regular meridians, 12 divergent meridians, 12 cutaneous regions, and 12 sinew channels. Later, okay, and the heart was divided into heart and pericardium. The pericardium meridian of hand 厥阴 was introduced to pair with Sanjiao meridian of hand 少阳. The meridian system also reflects the ancient official ranks. So in TCM, the heart has been regarded as a monarch of the body that should be carefully guarded against invasion by pathogens. And thus, the pericardium, as guardian of the monarch, needs to protect the heart from any attack by pathogens. So the indications, you can see the indications of pericardium meridian of hand 厥阴 clearly imply its clinical significance for relieving heart problems rather than treatment of the pericardium itself. Additionally, the number 12 may exert influence on other meridians. For example, Ren Mai, the conception vessel, and the Du Mai, governor vessel, were classified in the realm of 8 extraordinary vessels rather than regular meridians, although their running course, indications, and results of modern research have suggested that the Du Mai is closely related to the organs like brain and kidney. The Ren Mai correlates to the zang of the kidney and the uterus. And they are so-called conferential points of 8 extraordinary vessels. Okay, and also the theories of yin yang and the 5 elements also exert influence on the meridians. Okay, so these are the 4 dimensions I would like to discuss. That all these 4 dimensions actually have been recorded in ancient classics and also revealed by modern researchers. And so here, enormous achievements have been made on the substantive aspects of meridians, although the morphological makeup of meridians has not been fully identified. Multiple systems of the human body, such as nervous system, circulatory system, immune system, and connective tissue system, have been suggested to represent part of the meridian system. Thus, the study on the meridians from the perspective of a single system may overly simplistic, and a combination of substances that exist within multiple systems may contribute more to decode the meridian essence. And the research on physical structures of the meridian will surely continue to advance with novel research methods, better technology, and newly identified structures in the human body. However, more investigators are starting to realize that deciphering only the anatomical structure is one-sided for the research of meridian essence. However, only a minority of investigations have focused on the functional attribute of the meridians. The main difficulty may lie in the invisible and the transient character of the meridians and the meridian sensations that are unique in each person. Experimental and translational studies are required for evaluating the clinical application of modern tools in relation to meridians. And the research of meridian essence often overlooks the chronological attributes of the meridian system, and only a limited number of experiments and the clinical trials have been designed and conducted in this area. The midnight ebb flow theory for acupuncture is difficult to apply because it has a fixed analogy in consistency with classical acupoint selection, complicated time calculation, different treatment principles instead of TCM based on syndrome differentiation, and the need of tending to acupoint opening at a particular time. And the cultural attribute of meridians may help us understand the essence of meridians better and explain more rationally why certain results of modern researchers are not consistent with the meridian system described in the classic texts. Moreover, undoubtedly, scientific studies will continue to throw light on the essence of the meridian, and it is important for investigators to know that cultural influence has contributed to the formation of the meridians. This may provide different study angles and help with improving study design and methodology. The holistic horizon concept is a significant feature of TCM, and meridian theory is summarized based on the integral system of the human body. Therefore, meridian research conducted under the guidance of TCM holistic concept from an ancient Chinese perspective using a systemic research approach may yield more fruitful results than a modern reductionistic method. Okay, so this is all what I want to share. This is from an article just published recently. It's more theoretical, so maybe a little boring. Okay, so that's what I would like to share. Thank you very much.
Thank you very much, Professor Xiao. That was really fascinating. The considering the meridians across the 4 elements that you described, from structural, functional, etc. So that was very illuminating for me. So thank you for that.
Thank you.
Do you think the four will come together in
it's very difficult. Yeah, I think because researchers have shown these different aspects of the meridian, but surely it's difficult to combine them all together. But I think these are the dimensions we need to consider, especially I think the cultural dimension. Because you can see this is developed from the ancient Chinese culture. So maybe it can also, this system can also be improved.
Mm-hmm. Well, I suppose I look forward to reading the I look forward to reading the article. I think it'll be very, very, very interesting. And any questions from other attendees? Is there a lot of work going on then on the neurobiology of what's happening? I was interested in the mast cells accumulating around acupoints, and we're a stem cell research center, and it'd be interesting to know if there's if the meridians and the acupuncture is having effects on cellular behavior, like stem cells, for instance.
Yeah, surely. I think Chengdu University of TCM have conducted lots of researches on the meridian essence, and they have done lots of researches, and also from my article you can get the references for your interested field. Okay.
Yeah, no, thank you for that. So if there are no other questions, we've actually come to the end of our time for this session of seminars. And again, I'd like to thank very much Professor Jinrong Liu and Professor Xiao from the London Confucius Institute and the Coimbra. Coimbra. So we'll be looking forward to other contributions and presentations from some of the other Confucius Institutes of traditional Chinese medicine in the coming sessions. So this has been recorded, as I mentioned, and it's available on YouTube, and we'll let people know about the link. So again, thank you all. And
can I make a comment? Tim?
Yes, go ahead, Senming.
Yeah, and it's a fantastic and seminar, and this seminar is essential for Western people, for non-Chinese medicine people to understand how Chinese medicine, how acupuncture may work and in our body. And I learned a lot actually, and from biological point of view. And I also introduce even the circadian biology and the proteomics and the modern and technology into the research of the Chinese acupuncture, and fantastic. I also want to thank everyone. A great turnout, 22 people today, and for this symposium. And I know holiday the season is coming up as well. Just before, and the team the close, and I wish everybody a great summer and enjoy the holiday team.
Thank
and
you.
come back
Have a
to
good
you.
day.
Yes, I would echo that, Sanming, and I think even in Heiliangyang it's going to be warm for the next few months. So it's this is a warm part of the year, the summer. So, okay, we'll I'll end the recording, and thank you all again, and look forward to seeing you the next time. Thank you.
See you. Thank you.
Bye-bye.
Thank you so much.